How can you personalize your messaging to physicians for greater prescription intent? What are people saying about your brand? How can you make your marketing efforts more precise and effective? These and many more questions are answered on this podcast, which is here to serve as a playbook for all your pharma marketing needs. As your host, Soumya Prakash, co-founder of Multiplier AI Solutions, sits across pharma industry's top experts. This is your place to get all the insights about Gen AI, data, and beyond.
Hello, and welcome to yet another exciting episode of the Pharma Marketing Playbook Data, Gen AI, and Beyond. Your go to podcast for mastering pharmaceutical marketing, data analytics, and AI trends. Join industry leaders as we explore cutting edge strategies, the role of emerging technology, and how data driven insights are revolutionizing the pharma landscape. Tune in for actionable insights to stay ahead in the fast evolving world of pharma marketing. I am Soumya Prakash, co founder at Multiplier AI, and today we have a very special guest joining us, Dr. Crystal Variava. We are excited to welcome Dr. Crystal Variava, who has had a remarkable background in healthcare, spanning clinical practice in audiology, strategic leadership, and entrepreneurship. She is seen as a visionary leader in the field of audiology and a trailblazer in clinical communication performance. Dr. Crystal is the founder of True and Tested, India's first clinical communication performance company. She holds a Bachelor of Arts in Communication Science and Disorders, a BBA from Harvard Business School Online, and a doctorate in audiology from the University of Pittsburgh, specializing in hearing and balance related disorders. A clinical career highlight for Dr. Crystal was when she was federally recognized under the Obama administration for excellence in patient centered care. Thereafter, she moved to Mumbai to take on the role as Director of Audiology and Strategic Initiatives for Sonova India. While mobilizing programs throughout India, APAC, and ultimately the global market, she noted patterns emerging irrespective of country, culture, and healthcare systems. And this inspired her to create True and Trusted leadership in healthcare to provide and help providers with effective communications that are patient centered, purposeful, and profitable for today and the future of healthcare. We are thrilled to dive into her journey, her insights into audiology, and the future of hearing care and clinical communication innovation. It's a pleasure to welcome Dr. Crystal Variava to the show. Hi,
Thank
Dr.
you
Crystal.
so much. Thank you so much, Savi. That was a very lovely introduction. And to just be able to have a meeting of the minds today to talk about pharma marketing, AI, data analytics, and of course, patient centricity. So thank you for this invitation.
It's absolutely our pleasure to have you. Dr. Crystal, you have had such an extraordinary journey in audiology from clinical practice to strategic leadership. What initially drew you to the field of audiology, and how have your experiences shaped your passion and career?
Yeah, that's a wonderful question. I think, like most people, at the age of 18, when we decide to set out on our journey, I started thinking I was going into neuroscience. So I applied for a major in neuroscience, and I did that for a few years, where in which I ended up taking a course in Audiology 101. So I got to see the anatomy up front and close, looking at the auditory system. And yes, I love the brain, I love the mind specifically, but I really got excited when I saw the auditory system and I understood how the vestibular, the balance system works. And that really then transitioned into an elaborate clinical career where when I was sitting in the clinic day in and day out, I realized how important my own clinical communications were when it determined my patients' outcomes. And, what I can tell you is very quickly early in my career, I realized that hearing, it's not about hearing words, right? It has a great social impact. It's more about the social connections a person tends to lose It reflects in their cognitive abilities and mental health. It also really affects a person's confidence to be, an active participant in the world. So the more I was meeting patients with hearing impairment, and the more I was starting to treat them, I realized that, this is a very fulfilling profession to be a part of. And any audiologist will understand this. I don't want to compare apples to oranges. When we think about ophthalmologists and we think about blindness keeps people away from things, right? And in hearing loss, hearing impairment keeps people away from people. So I was very professionally fulfilled working in and out with my patients and their families. And as much as I loved that aspect of my clinical day, every appointment was always met also with resistance. And just hear me out. As an audiologist, people don't come running and skipping to see me. I'm not a dermat where someone wants a little bit of Botox or an elective surgery. I'm not a plastic surgeon. I'm not even an ophthalmologist or a dentist, someone who wants veneers. People go to see the audiologist, let's be very clear, when the chronic hearing loss has really gotten to a point where they know they need help. Yeah. So, as much as I'm enjoying sitting side by side assessing my patients, there comes to be a point in the moment where I recommend a treatment. And unfortunately, the typical general hearing aid technology for patients are hearing aids. And you can imagine the amount of resistivity that just kind of comes into that patient's face and in their mind. And I realized that even though I'm really good at assessing and diagnosing and figuring out the correct treatments, when it came to convincing my patient that yes, this is the treatment you need, I was met with a lot of resistivity. Of course, it's price, it's social stigma, it's having to manage now hearing aids that is just something that they're adding on to their day to day. And I did what I thought was best at the time. And I just counseled, right? I brought a lot of value. Why are these hearing aids $6,000, sir? Well, let me tell you why. I brought so much value into the product. Let me talk about the advanced features and technology. Let me talk about this type of circuitry, these options of connectivity. And I was failing miserably in the clinic doing that. And over time, I realized I had to shift. If I really wanted to provide good patient-centric communications, I have to get my patients to agreeing to treatment because that's the only way to get betterment of health. So I shifted my communications from more product-oriented to purpose. Crystal, what is the purpose? Why do they come in to see you? The minute you start having those types of conversations, the minute you start to uncover and unpack all of the social challenges that they're having, and you start seeking solutions, a joint approach to the solutions they're really requiring, believe it or not, the conversion happens, the adherence happens, the user benefit comes, and all of the struggle that I was trying to get my patients to do by really saying, this is the best treatment for you, I realized that's not the route to go. To really get a patient motivated for treatment, you have to become more patient-centric in your communications. And that's a lot of different conversations that we might not have really been taught of in formal school. So I really enjoyed that aspect of work. And when you get good at something, what happens? You want to teach others. And so from clinical, I moved to India and I took a corporate position where I had a team of audiologists and we were going out all over the country teaching other providers how to have these types of communications. And it became very satisfying. So suddenly my focus was not about my 15 patients I'm seeing a day. It was, oh wow, Crystal, you can train 100 audiologists. They can go back into their centers, their hospitals, their clinics, tier 1, tier 2, tier 3, you name it. And now you're getting to change the lives of 1,500 people, through the provider. So my career, in a way to just sum it up, I think it's moved away from creating, yes, quality of life is being changed, but doing it with more impact. And that's what's kind of made me pursue my passion to leave the US, to come to India, and to work with providers here.
Wow, what a remarkable journey, and merging both passion and purpose. And definitely you're driving a very significant impact, as you mentioned, with your communication trainings, etc. So just coming back, audiology has seen significant advancements, specifically in the recent years. Could you share some of the cutting edge innovations or treatments in hearing and balance care that make you very excited? And how do you perceive them coming from a patient outcome or a patient centric approach? What's in it for the patient?
This is brilliant. I'm very fortunate to be an audiologist because I think audiology has always been a forerunner when it comes to digital advancements as well as AI powered technology. And I'm talking about very early on in the 2000s, when I was practicing, we had hearing aid technology at that time where when my patients left the clinic, I could not only see how many hours a day are they using their hearing aids, right? So a lot of data analytics, a lot of machine learning, okay? Back in the 2000s, we're talking. But what I could do is actually start to, through this type of machine learning, is understand the types of environments my patients were in. How many hours a day were they in noisy environments? How many hours a day were they sleeping? How many hours a day are they in quiet environments, at the desk, walking down the street, driving? So suddenly, as a provider, I started to be able to take all of that data and really fine tune best outcomes for my patients. And I pride that we're talking the early 2000s. Now everyone is talking about machine learning and AI. So you can imagine the advancements hearing aid technology has had now to 2020. Hearing aids, the goal for hearing aids is to keep it seamless. It's for my patient to be able to put them on in the morning and forget that they're on, right? Because we don't have to change the programs. The hearing aid technology nowadays, they're listening to the environment every millisecond. And let me give you an example. I think sometimes this is the most exciting. I could be driving in my car and I'm looking straight. My husband is talking to me and I'm severely hearing impaired. Okay. And I have automatic directional technology to be able to shift the hearing aid. So it's cutting out the road noise on this side of the door. My hearing aids are picking up my husband's voice, and if my kids start yelling in the back, which they tend to do, my hearing aid technology will also identify that, oh, there's a lot of loud noise. We don't need to listen to this background noise. We're going to just focus on this person's voice because Crystal's intention is to hear what she's wanting to hear. We don't have to look. Okay, we stop the car. I open the car door, and seamlessly, my hearing aids every millisecond are sampling the environment. When I open the door and I get out, let's say I'm linking road and it's noisy and it's bustling, automatic noise cancellation kicks in. It is keeping still the sound of my husband's voice crystal clear, but it's reducing a lot of the extraneous voice that would impact my understanding ability. And then the minute we open up a door into a coffee shop where it's quiet, maybe there's some ambient music playing, my hearing aids are constantly processing all of this information and it's seamless. And I don't have to worry about it. I don't have to think about it. I don't have to charge batteries anymore, right? I mean, we've come such a long way, right? It's fully integrated into my hearing, my phone. I'm a normal hearing person, Samia, okay? But when I was at Sonova, we had technology at our fingertips. We were manufacturing these devices. I used to wear a hearing aid just for the fact that I didn't have to carry my phone anywhere. I would put a hearing aid on, and if I was in the boardroom and I was getting a call, I'd be able to answer my calls right from the hearing aid, have a conversation, and disconnect. I mean, it's moving away now for, yes, we used to think about hearing aids as just a solution for hearing impairment. But now, with companies like Sennheiser teaming up with Sonova and Jabra, which I believe is with GN, and Starkey and Apple, what we're starting to see is younger and younger people wearing hearing aids today without amplification, right? The adoption rate is getting much lower now because we've able to create these AI systems that excite even normal hearing people. And yeah, I'm 38 today. I don't have hearing loss, but I'm wearing a solution And maybe when I'm 48, I do. And suddenly my audiologist now activates not only all these fancy features, but a hearing solution. So I think in the world of hearing aid technology, it's becoming seamless, it's becoming integral to the patient. It's hopefully getting to the point where we put on our glasses, we forget about it, and things are great. When it comes to the balance side, there's some phenomenal advancements happening. And I think sometimes giving cases and examples are the best ways. Say you have a fall risk patient. She's 72. She lives in a tier 2 city. Her specialist maybe is in Surat, where it's hard for her to get out of the house. She's dependent on her son, maybe her daughter in law, and she's had multiple falls. We need to rehabilitate her so that she can walk around her home, so that we're not having more falls and creating greater risk. So, what a rehab specialist could do, or an audiologist could do, is give her a rehab program that uses AI and virtual reality coming together. And in the comfort of her own home, in a very secure, safe environment, we can start training her abilities and we can measure everything about it, right? We can measure the gait, the sway. We can determine whether or not she's still at risk for a fall. If she is, we can also alter the rehab program that she needs to undergo. So now we're talking about personalized care that's happening in the comfort of a person's home and precision care because we can actually assess everything at such a fine, minute level. So I think healthcare is it's phenomenal where we're going to go with AI in the future. It's a very exciting space.
Yeah, great. I think it's and many great use cases that you have shared, from a patient's perspective, how technology is enabling. You also mentioned that you've identified key patterns in the patient provider communication, across when you worked across different healthcare systems. Would you like to share some more insights around those challenges and what did you infer from them? Or what are the learnings that going forward providers could implement or practitioners could implement?
I'm laughing because I feel like this could be a 2 hour discussion right here. And I'm just laughing because I know as a speaker right now, I've got to really make my points crisp. Yeah. When I came here, the talk was, oh, आप तो American है, आपका कैसे पता चल जाएगा कि क्या होता है मेरा patients के साथ, right? It was this resistance from India's market initially to say, what does this American doctor know about what's happening with my patients and what we're doing here? And wow, healthcare, it's complex, yes, but illness, it sees no difference between person, creed, gender, race, color, socioeconomic status. When a patient gets ill, there are a lot of universals around that. Fear, anxiety, stress, decision making capabilities decrease. These are human universal behaviors. The same thing I started to see with healthcare providers, not just audiologists. I'm talking about oncologists, neurologists, dermatologists, you name it, specialists, elective. And what I want to do, just to really try to make these points concise here, is I want to just look at the trends that I noted between the patient provider relationship. Just that. What did I see in the US and what did I see in America, or sorry, in India and in China and in Singapore and in the UK? Number one, we are unfortunately at a place where there is a trust crisis globally, right? In India, 92% of patients do not either trust their provider or the healthcare institution that they're walking into. Wow, right? Alarming statistic here. So, what does that mean now for the provider? There's already so many barriers to move them into treatment. How are we going to get them to improve their health when they don't even trust us, right? And it's not to say this is just India. In the last decade, in the US, we are seeing a significant decline, Y on Y, year on year, of how much patients trust their providers. So this is a big issue. This is where True and Trusted clearly sees that if we can focus our attention strategically here, we'll really be able to move the needle on creating better outcomes for everyone in healthcare. So trust is a big issue where we're seeing a decline everywhere. The second is if you actually ask patients what is the greatest challenge that you're finding with your healthcare experience, they will always say it's the communication with their providers. My doctors rush me, they're not listening to me. And wow, that is a great significant area that excites me clearly because that is a need of the hour. We understand that now. And what's the trend here? Let me zone in a little bit here. Is okay, when a patient, and let's just do some perspective and role play, because my patients don't trust me, right? When they walk into my clinic, I have to work extra hard, right? And when it comes down to recommending a hearing aid solution, which I know they're not going to want, right? There's going to be so much more resistance. And what's going to happen for Dr. Crystal, who studied all these years, who wants the best intentions, and the best outcomes for their patients? I get desperate. I get desperate to try to convince my patients that Dadi, sirf trial kar dijiye. That's all I want. Just do a trial for a month. If you're not happy, that's fine. No money taken. But I now start to come off as very desperate and salesy, right? Because medical students are not taught how to sell treatment. Okay, they're just not taught today. True and Trusted would love to get there. So now Dadi feels like, is she a doctor or is she just selling me something? So now trust is declining even more. So are you seeing how it's kind of this vicious cycle? So trust is already low. We're kind of influencing our patients to get the surgery. Karna hi hai, are bahut chota surgery hai, karwa dijiye, right? It's very simple. Get it done. What are you worried about? Well, yeah, I'm worried about general anesthesia, right? But we're not having those conversations. So it can go much deeper, Soumya. We won't get into it today. It's an exciting topic. But now I'm going to come to the third point. And this, for me, it was the final straw that broke the camel's back. When I understood that the world over, I don't care what role you have in healthcare, I don't care if you're a student, if you are a business owner, if you're a multinational manufacturing medical devices, if you're in pharma marketing, what I was seeing, because I was a part of the academics with Sonova, I was really able to access a lot of leaders in these areas. And what I felt and what I heard was very similar to what is also, or what did happen in the US a few decades back, where I realized that healthcare providers are all diseased. We're having high levels of disease in healthcare. And hear me out. I know you're thinking, what are you talking about, Crystal? I'm not talking about in its literal way disease. We don't have conditions, disorders. We have symptoms though. And those symptoms are what? High levels of stress, anxiety, overwhelm, right? How many doctors just feel like, oh my gosh, depending on what your role is, if you're an elective healthcare provider who has to sell treatment such as cataracts or root canals or hearing aids or dermatology, treatments, you're having to sell a treatment and you feel really overwhelmed because you don't sell that treatment. You're not really bettering anyone's life. Let's be really factual there. And what I felt was, hearing it from students, from professors, from practicing providers, junior doctors, senior doctors, everyone has their own unique level of dis-ease, okay? And I want to now tell you a story where I started to get dis-eased practicing in the US and how I see that now coming to India a decade and a half later. When I was practicing in the US, and this is all due to the digital transformation, okay? So patient-provider relationship we're talking about right here, right now. The three issues are trust, clinical communication, and this dis-ease it's causing between the providers and their ability to have a solid clinical presence. Let's paint some pictures. I was working at the Ioneer in Pittsburgh, and we as a hospital decided to go with Epic as our electronic medical record system. So the team comes in, and we went from paper, writing paper files, a big room where we used to file all our patients, to this Epic platform. And I had a patient who had come in who was vomiting profusely. I had run a few tests. I said, okay, we need to have a stat to ENT. I send the patient upstairs. He's not in the best shape, as you can imagine. And I'm getting calls from the ENT department saying, Dr. Variava, where is the report? Where is the report? And I said, I've sent it. Well, because I didn't know how to integrate that technology, my reports were not closing, and I, the ENTs could not technically see that patient till they saw my report. So that was really overwhelming, right? Already I'm trying to do the best I need to do day in and day out as a healthcare provider. And now I have to do what feels like 50% is administration, right? So when the digital era came to the US, there was a lot of resistance from doctors. There was a lot of chaos. There was a lot of confusion. And that happens with any type of change. I remember working at the Children's Institute where I was used to, okay, now I got close, good with Epic. I'm writing my clinical soap notes, I'm closing them, I'm doing my ICD-9s so that insurance can kick in. I've learned it. I go to a new facility and they say, well, now you do transcription. What is that? Oh, that is where I don't have to actually type. I just have to read my reports. Excuse me.
Yeah.
And dare you make a mistake, Crystal, you have to start from the beginning. And so initially when I started, patient 14 years old, came to the blah, 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 reports of da, 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 here's the assessment. You make one mistake, start again, start again. So even though my days were supposed to end at 6 o'clock, I was, in the clinic till 9, just doing transcriptions. And, what I saw was, it's a phase. It's hard. If we talk about patient centricity, Samia, because I know you love talking about this, you guys. I remember when I was working at the James A. Lovell Federal Healthcare Center, this was about 2011, 2012. Our director huddled us in, and she said, great guys, we are spearheading patient centricity in the US. You guys are doing a great job. Your performance is really high. All of you guys now have a unique email ID. And I thought, well, why, right? Why are we talking email? Because I already had about 300 unread text messages in my personal inbox. And we come to find out now that we are now being incentivized to make sure that patients reach out to us over email for any issues. And we have a turnaround time to respond to that email. So if a patient emails me and I don't respond within 48 hours, that email gets pushed into my director's inbox. So now you can just imagine the amount of overwhelm. We already are juggling the day-to-days. We already are trying to do our best. And now it just felt like moving towards patient centricity just felt like so much work. It really did at the time when I was in the thick of it. Now I completely have a different perspective and a value for it. And so when I kind of figured out my way in the US and then I shifted to India, I saw, the digital era hit India, right? In 2007, we had a boom of privatizations. We had a lot of foreign nationals influxing India just to build institutions. And then the digital era hit a few years later. And lo and behold, it's 2015, 2016. And I am seeing providers still to date struggling with how are we able to usher in the digital era in a way that works well for us in our day-to-day practice. So one is just the operations of the digital aspect. That's a trend. The other is, and this is where I get excited, but we're going to abbreviate it. The other is, and this is the big reason, is when patients started to hold smartphones in their hands, the game changed, right? Because suddenly the knowledge was with who? It was always with doctors. Patient is unwell, they come to see you, you assess them, you tell them their issue, you give them the treatment, they go home, they're passive, they're docile. ठीक है डॉक्टर मैं करती हूँ 3 दिन के बाद मैं आऊंगी. Now patients get sick, they get their blood work, and boom, they go straight to WebMD. Now they come in with questions. They looked at treatment options. They've already self diagnosed themselves. So half of the appointment now is just undoing, right? It's undoing all of their misinformation. And now you're telling me that I've got to do my best practices in clinical work. And then on top of it, you're going to add on all of this administration, soap note writing. It's overwhelming. It is. And that's the beauty, there's a lot of resistance right now. There's a lot of tension between patient provider communication. And there doesn't need to be. There really doesn't need to be. But that's what I'm here working towards now. Sorry, that was a really, really long answer to a beautiful question. To summate, it's the decline in trust. That's a big trend happening everywhere. It's poor communications, it's affecting the patient experience. We want to do best as doctors, but there's better ways to communicate. And the third is doctors are just overwhelmed. Providers are just in this high level of dis-ease with their day-to-days that we need to look at.
Yeah, I think you have touched upon some of these real core issues. Nobody really speaks about the doctor's anxiety, the doctor's health conditions. I think these are just unspoken of facts. And it's important because if the doctor herself is not feeling the best, how can she do the best for her patient? I think that's something which is so important. So I understand where the passion, where the purpose is coming from, and why are you so passionate about when you're talking about patient, why are you bringing that particular physician also into the picture? Because they are part of the picture. Until the trust, till the communication is kind of aligned, it's very hard to bring to what they want to achieve, the patient getting treated and the physician trying to get the best for their patient outcome. So I think I can understand that. However, coming back and drawing back, since you have such an illustrious career spanning, donning multiple hats, and the recent one, being an entrepreneur and having founded True and Trusted, which is such a significant milestone in your career. Would you like to share, what was your inspiration apart from, the patient centricity and the trust that you have mentioned? Anything else that you would want? Why did you look at this, and what's the core value that you want to drive through this company?
Yeah. When I left the US, it was really clear. I just wanted to serve and to have purpose in what I was doing. And I loved when I was with the corporate outfit Sonova because what I got to do was, in a very simplistic way, introduce patient centered care and see how the business could benefit as well as patient satisfaction, right? Those were the two goals. But the byproduct was this provider in between, where providers were saying, ma'am, thank you so much. They don't feel like they need that second opinion anymore. They've taken the treatment. I feel like I'm serving my purpose more. And things, honestly, Samia, things were going great year on year. We had a lot of growth. We set up a new vertical. And I was honestly very happy, but there are times in life where you just need that one interaction with someone. And, it completely just changes the entire trajectory of your life. And I had that in Chennai. I had just finished giving a talk at a medical university, and a young gentleman approached me and he said, ma'am, thank you for today's talk. I attended your workshop in Mumbai a few years back. Now he's working for a big private hospital chain. And he said, all of the things that you told me I'm carrying in my day to day. And so what happened? My shoulders were big. I was beaming inside. And then he says, but, and it was this laundry list. I mean, such a long list of him spewing out all of these challenges. Yes, I helped him, but it was up to a point. It was all these challenges about the patient's behavior, right? And what are the patient's behavior? We kind of know now because they don't trust us. They're not really open to discuss their issues. They always have issues with pricing. Absolutely. Why not? It's a privatized healthcare market. They want to talk discounts. They want to open up Amazon and say, I'm getting it cheaper here. How come you aren't as cheap? These are conversations now that I realized where I was employed, they weren't wanting me to focus on. Let me be very honest. And I thought, wow, Crystal, you need to do better. You just need to do better. You've done good, but you could do better because it's not just what he said, it's where everyone's dis-ease was lying, right? And that was the flight home When I was on my way back to say, wow, we are all in a level of unease, unrest. I have clinicians telling me in the morning they don't want to go into clinic. They know that patient is going to come in. That's very challenging. They don't know what to do. I thought, wow, we deserve so much better as providers. We do. Because our intentions are always for our patients. So that needs to be reflected. So it was not something I really thought of. The talk was a Friday, and Monday morning I put in my resignation. I did not have a plan, Samia. I did not have a plan. I'm not going to lie. I was not like most people who start to put their ducks in a row and then make that announcement. I just I just did it. And it was a surprise to them as well as to me. And then I spent 3 years. I spent 3 good years going back to the science of understanding what is it and how is it that providers can communicate to improve the conversion rates of patients. There is science for that. To ensure that they're actually taking the recommendation that I want and not a cheaper solution because of price. We know price is an issue, always, of course. And it took 3 years of just studying new sciences, getting certified, and True and Trusted came to be because if you reverse engineer all of the science, looking at validated, peer reviewed papers at conversion and average selling price, everything boiled down to two key variables. Trust is all about conversion. If a patient trusts you, then I'll tell you, they might not get exactly what you want with best outcomes because of price, but at least they're on that journey of conversion. And if you're seen as transparent as a provider, things just move much easier. So we created True and Trusted. I would say the mission website's getting redone right now, but the mission is always that real boring statement, right? But what I truthfully feel is we need to now teach providers how to have clinical communications that are patient centered. And what does that mean? That's another talk, another day. Because when I was in school and we learned about patient centric everything, it was all theoretical. There was no real understanding of what that looked like in the clinic, but it needs to be patient centered. It has to be purposeful, right? It has to serve my purpose as well as a provider. It has to serve my patient's purpose. It has to serve the institution I'm working for's purpose. And it needs to be profitable because only when we can drive profits can we get better technologies, better integration, better solution for our patients. So it needs to be now for today's issues as well as the issues that are going to come in the next 5, 10, 15 years because AI is not stopping. Patient information is just growing. And accessibility, when we talk about patient centricity, patient centered care is not doing something. I want to make it really clear here. At True and Trusted, it's very clear that when we talk patient centered care, this is not something that a doctor applies onto a patient, right? It's not like a treatment we're putting on them. It's something that we have to do with the patient. And that changes the dynamics where doctors have to get more comfortable to discuss treatment options that patients are willing, wanting, and ready for. We always want that optimal treatment solution, but let's be honest, if a patient's not ready for that today, we need to start where they are, and that's true patient centricity. That could be just agreeing to going in for a counseling session to understand whether or not they will be able to use the insulin injections every day, right?
Yeah, of course. Like, as you rightly mentioned, sometimes such triggers or real world experiences are sometimes pointing us to a certain direction, and they change our complete perspective on things, and they lead us somewhere where possibly our passion and our purpose lies for our lives. I think that moment happened, for your company, and good luck on that. So much with the digital and patient centric strategies, and you work also in such great depths with pharma clients. So I would want to take your insights on how do you see the role of marketing evolve, coming from a pharma perspective, with the use of AI and data driven insights.
Yeah, I mean, it, let's before we actually talk about the here and now today, I would like to just touch upon what was, right? And what was typically pharma marketing was a communication that was a one-way message. Company would contact the healthcare provider, or company contacts the patient through advertisements, brochures, something or the other. Now, pharma marketing has really put the patient at the center of its services and strategy. And that's with the data analytics that we'll talk about in a second. What do I mean by that? Let's just give a case here. Before we do that, we can say that pharma marketing, it's much more holistic, it's much more comprehensive. They are leveraging AI. We now, just by using the internet and searching, let's just talk about one variable of internet. We know the patient's interests, we know what they need, we know what they want out of healthcare, we know what is acceptable to them, right? Remember, the ultimate goal is to always move patients towards betterment of health. As a doctor, we always think it has to be the treatment that I'm recommending. No. We have to just get them on that healthcare journey and then nudge them along the way. So, just based on online behavior, we're starting to get a lot of data, and that's where data analytics comes to play. I'll give you an example. I am a 62-year-old gentleman living in Borivali, and I have an enlarged prostate. I've been informed. I've been told I need surgery. Now, I'm deathly afraid of surgery. What patient isn't, right? And rightfully so. And maybe I'm looking online or my son's looking online and they come across to see that, okay, it's understanding me. I'm interested in this type of a treatment. I'm looking at outcomes. I'm looking at efficacy. And boom, I get this advertisement of C3 Medicare and Gotcoper, where this Dr. Rochan, who has 30 some years experience, who's HOD of interventional radiology at a private hospital, is now providing a treatment that is going to literally be a prick and 2 hours of sitting, and my prostate will shrink. And I don't need surgery, and I can walk out of the clinic after a few hours. And for me, like, that is precision care, that's personal care, right? Because I'm not ready for that surgery. I'm not saying that is the end all be all solution. That's the doctor to decide ultimately. But what is going to happen? I'm going to get a little placard, put your name, put your number, how would you like us to contact you? And when that hospital contacts me and they set up an appointment for just a consultation, it can go one of two ways. Hear me out, Samia. Dr. Rochan can investigate me, do all of the assessments, determine my candidacy. If he says, Crystal, great, or not Crystal, but obviously a man, you're a great candidate for this treatment, boom, I've got what I needed, right? I didn't want surgery. I didn't want that downtime. I didn't want all that fear and that stress and that anesthesia. If he determines, well, Crystal, you're not a candidate, unfortunately, because of all of these reasons, right? So I would really suggest a surgical option for you. It's not what I wanted, right, Samia? It's not what I wanted. But what can I tell you? I will be more open to get that surgery now with who? Obviously, Dr. Rocha, right? Because he's given me options. He's discussed what I've really wanted and what I've been invested in. So, pharma marketing, it's really just getting into the mind of the patient, understanding the behavioral needs, their trends, their tendencies, and creating marketing information that is not just personalized to what it is that they're wanting to seek, but also targeting the correct audience. It is supremely powerful. Need I say maybe there's some danger involved, but that's where ethics always comes to play. It's just fabulous to see how AI and data analytics are being used by pharma marketing companies, and the applications are really wild if you just know what you want to look for.
Yeah, that's true. I think AI and data, the way they are going to get used in the coming years, is going to phenomenally change the game. And that's what so many thought leaders coming from pharma, healthcare providers are sharing on this platform. And beyond, that's going to be becoming mainstream. And do you, I mean, specifically see how healthcare communication could benefit out of AI and data, and any perspective on that?
Oh yes. Oh yes. I'm very clear when I made True and Trust, I'm thinking about the future of healthcare. Healthcare communications in the space of AI and data analytics, and a lot of other new parties playing into healthcare. It's a very exciting space. But if I have to visually see it, it's that tightrope walker at the circus who's walking that fine rope, right? On one side, we have technology, amazing technology that is going to streamline so much of what the doctors have to do. It's going to automate procedures, it's going to get precision, it's going to be more clear on treatment options based on risks. AI is really going to offload a lot of work for our doctors. And I know at many conferences, doctors are, they sit on eggshells when we talk about AI. And here's what I'll tell you, you have nothing to worry about. Because ultimately, technology is never, ever, ever. And I know Harvard is working, MIT is working, they have these new beta types of robots, and how are we creating empathy and emotion with our patients? That's a different story. But what I'm talking about right now is technology is coming up, and we as providers, we don't need to feel inferior. We don't need to worry. We need to leverage. We need to learn how to partner with that technology in an ethical way, in a safe way. And what I see the communications now, it's going to change, right? My patients are going to get assessed. The type of hearing loss is going to get determined. The hearing aid solutions will also get determined. The recommendation is going to be made for me. And now, me as an audiologist, I don't have to touch a piece of equipment. All I need to do is sit face to face with my patients and talk about all those barriers that exist between them and seeking the treatment. And it's uncovering that. And if we think about the evolution of a doctor, they were soothsayers, they were sages, they were Nadi Shastras, they were Veds. Now we have that family doctor. I think everyone in India, 20 years ago, we had that one family doctor we would always go to, we'd always trust. Because of the digital era of healthcare, which we haven't gotten to talk to today, maybe on another day, we don't trust the super specialist who's sitting in that unknown hospital. And now it is the time where we, because we can leverage technology to do a portion of our work, we can bring in compassion, empathy, understanding. We can really get to the crux of what and why and how can we motivate the patient to say, yes, I'm ready for the knee surgery. Yes, it's not just the knee surgery. Now, hear me out. Here's a case. A doctor recommends a patient to knee surgery. They have years of hesitation, right? Finally, it gets so bad that they're convinced. Now, after knee surgery, what do we know? We need a lot of aggressive rehab, right? Or we're not going to get the mobility in the knee as we want it. Now, if the doctor hadn't spent that time to talk about the real value and importance of the rehab, if they haven't, what's going to happen? The patient's going to walk in a year later and say, Doctor, you did a very bad job implanting my knee because it's so hard to walk down the steps. And the doctor is feeling, what? You had to do the rehab, right? I did a great job. And let's review the video, right? We've got video of all our surgeries now. If AI does the surgery, you can't blame the AI, right? Precision technology. No, listen, we have to take that time now to have those conversations that we know that patient is going to require to get the best outcome, right? And that is where the future of AI and technology coming in, doctors are going to have to kind of go back in time to be more of that healer, to understand what are the barriers that are stopping them from actually moving towards treatment. And that's true patient centricity. It's not a script that we doctors can throw out anymore.
I think to capture it or summarize it, the steps before, after the treatment, the kind of patient assistance that is needed to make the holistic health of the patient really get well. I think that's where AI and digital technologies can do so much, and also kind of help the physician in maintaining their own sanity and their own lifestyle, reduces their burden from administrative tasks. So,
Yeah.
kind of summing it up, it was a wonderful conversation. I would just like to take your advice. What would you advise our aspiring audiologists or healthcare professionals, who are passionate about making a difference? And in any way, what leadership skills they should look at in developing within themselves? Any advice on that?
Yes, leadership skills, making a difference. I think, and I'm talking from my own experience. I think in terms of leadership skills, adaptability is so important, especially now in this fast dynamic landscape of digital healthcare and AI and data analytics. Leaders need to be able to pivot and change strategies and think more holistically, not get so stuck into, well, this is what I thought we needed to do, and this was the 5 year vision. Change the 5 year vision, right? Just change it. It's just that simple. You got to be able to pivot. And I think with adaptability, you get a lot of agility as well. So those decisions also become easier. And now, when it comes to decisions, I think another great quality every leader needs to have, and I think that's really driven me in my own professional career, is empathy. And now, hear me out. I don't mean empathy and, oh, I'm sitting with you and I'm feeling what you're feeling. No, 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 no. What I'm saying is, how am I going to motivate my team to work hard, right? So a really good empathetic leader knows that new treatments and new protocols, they have people, they have patients, and they have providers behind it. And for an example, if let's say I'm a director of a hospital and a multinational Gen Z type of company approaches me saying, we've got this new technology, we'd love for you to integrate it. I'm going to ask two questions. The basic, let's just start the basics. How is this going to impact the experience of my patient? And how is this going to impact, let's say, workflow for the provider? And if one is a negative, off, off my table onto the next. If it's positive and positive, then decision making, when you have really good empathy qualities, decision making becomes so streamlined, Sonia. This is what I've experienced. Where, okay, yeah, it's a win for both parties. Is it going to be a lot of work? Absolutely, but just roll up your sleeves and let's get to work. So I think adaptability, agility, sprinkle in some collaboration and transparency and a little integrity, of course, always, always, always. There's many qualities to lead, but those I would say really do resonate with me. And in terms of making a difference, here's what I'll say. Whatever role you're in, whether you're in the clinical setting or in a corporate setting or in a professional setting or even a personal setting, the difference can be big or small. And what I have learned in this very tumultuous journey of leaving US and coming to India and looking now at the global market is you have to trust in yourself that you can make the difference. No, no, not you can make the difference. Let me take that back. That you will make that difference. Okay? And here's the two variables that I always look at. It's one, curiosity. Like, are you so curious to make this difference? Like, what is it about this that really gets your blood racing and keeps you sleepless at night, Crystal? Are you curious enough? And the second part is, do you have capacity? And capacity is in many different forms. It's financial, it's time, it's money, it's emotional, right? And if you have both, then I always take Nike's slogan and say, just do it. Just do it. Don't worry about how it's going to look. If you're fantasizing at night and that little smile curls up on your lips, just like how you have right now, Savia, if it does, you have curiosity, you'll have the perseverance and passion, and you have capacity. I would say just do it. Make the difference, no matter how big, how small. If you want to change your own personal workflow, do it. If you want to change your departmentals, do it. If you want to change the way healthcare is communicated all over the world, do it. But I'll tell you, you need both. And I'll give you a quick example. If someone told me right now, at the age of 38, to leave the US and move to India and explore India's healthcare, Crystal, and find something that really motivates you, would I be curious? Absolutely. Absolutely. I'm still curious. But would I have the capacity? At the age of 38, I'm going to be really honest and say no, because I have aging parents. I've got two sons. I've got a husband. So that emotional capacity, I might have the financial, I might have the time, I might have everything else, but I don't have that emotional capacity. And honestly, I would have missed out on such a wild life if I didn't make that decision in my second decade of life that I'm now getting to live. So I think if you really have it in you and you can see yourself doing it and that you're going to do it, just do it.
Wow, wonderful. I think it's a phenomenal conversation we have had. Thank you so much, Dr. Crystal. It has been truly inspiring to hear about your remarkable journey, right
Thank
from audiology to leadership and entrepreneurship. I think we really covered a myriad range of topics today. We are grateful for your time and the wealth of knowledge you've shared with us. And I'm sure our listeners will find your experience invaluable as they navigate through their own careers, in healthcare and beyond. To all our listeners and audience, thank you for tuning in to this episode of the Pharma Marketing Playbook. If you enjoyed this conversation as much as we did, don't forget to subscribe and stay connected for more such inspiring stories. Until next time, this is Soumya Prakash signing off. Stay innovative, stay informed, and keep pushing the boundaries of what's possible in pharma marketing. Thank you once again, Dr. Crystal Variava, for your wonderful insights and great talking to you today. Thank you so
thank you
much.
so much, Samia. Thank you.